Together we achieve victory over heart failure.
Hello everyone, I am Dr. Akshay Dhore, cardiologist from Sanjeevan Multispecialty Hospital, Amravati. Today's topic is basically about heart failure. So we'll see what we can learn about heart failure. There are two things which are different entities but often gets confused are heart failure and cardiac arrest. Heart failure and cardiac arrest are two different terms. In cardiac arrest, what happens is heart suddenly gets stopped and we need to revive it by CPR and another medicines. But in heart failure, what happens is heart muscles which contracts heart gets damaged or gets weakened so that its heart's pumping capacity gets decreased. What happens with heart failure, heart's pumping capacity is whenever our body needs some blood, it cannot get provided by our weakened heart. So what we can do and what are the various causes for heart failure? Most important cause of heart failure is vascular. That means what we hear by blockages, by which are investigated by our angiography. This is the most important cause of heart failure. Another causes are genetic, muscular, alcohol, vitamin deficiency, or after delivery. This can be the another causes of heart failure. So whatever the reason, we need to treat that reason. If patient is having vitamin deficiency, then we need to treat that deficiency. If patient is having some blockages, then we need to treat that blockages by angioplasty or bypass, whatever the patient is requiring at that time. Then another aspect of that is even after this treatment, some heart damage remains. So how to treat that? For that, there are 4 to 5 pillars of medicine to treat heart failure. One pillar is diuretics, that is you need to remove the water, excess water from body so that heart will not have to pump the blood of more than its capacity. So that heart failure symptoms will not develop. Heart failure symptoms are breathlessness, uneasiness, sweating, sometimes giddiness, and sometimes even loss of consciousness. So these symptoms can be there, and most important is weight gain or pedal edema, that is swelling or fit. To avoid that, we need to continue medicines like diuretic, then AC inhibitors, or one of the most important latest invention is sacubitril valsartan. Then we need to give beta blocker. Then fourth pillar is nowadays called as SGLT2 inhibitor, that is dapagliflozin. So these medicines will help us to reduce the symptoms of heart failure, and at the same time, it also prevents further damage of heart by reducing cardiac remodeling. Cardiac remodeling can be prevented by only two drugs. One is sacubitril valsartan and another is spironolactone. So these two drugs can actually reverse the cardiac remodeling and help regain its pumping capacity which was previously there. So all these things, if you can do, then heart failure symptoms can be reduced. At the same time, you need to tell and educate the patient and relatives about the heart failure symptoms and heart failure patients and what things you need to look for the patients. You need to tell patients that you cannot do heavy exertion, heavy exercise you cannot do. Then low salt intake should be there. Then around 1 to 1.5 liter or 2 liter of fluid should be taken, not more than that. Medicines should be taken, complied with. At the same time, what are the causes we need to treat? And we need to have our monitoring for sugar as well as blood pressure. And if we adopt these healthy lifestyles, then definitely heart failure symptoms can be reduced and these people will definitely get benefited. Thank you.